rehabilitation is a comprehensive intervention based on number 1, education, number 2, exercise training, number 3, behavioral therapy or psychotherapy for patients with lung disease, especially those who are suffering from shortness of breath or a very disturbing cough. And the main objective of pulmonary rehabilitation is to make those patients more functional so that they can have a better life.
Ang pulmonary rehabilitation dito sa Philippine Heart Center ay nagsimula noong December of 1990. Ako ay ipinadala ng Division of Pulmonary Critical Care sa University of California, San Diego Medical Center upang mag-aral ng pulmonary rehabilitation and exercise. Ang teknolohiya ay dinala ko dito sa ating ospital at nagsimula kami nang wala kaming kwarto na permanente na gagamitin para sa mga pasyente. Kami ay pumupunta sa mga iba't ibang conference rooms. We go to conference rooms that are available at that time. And we started with actually 2 patients, after which we developed the program and included our respiratory therapists and our pulmonary fellows. The beginnings were a little bit difficult. There were challenges because of lack of facilities at the time. It took some years before we were able to get our own room and eventually transfer to the 8th floor where the pulmonary rehabilitation is currently being done.
So the indications for pulmonary rehabilitation include persistent respiratory symptoms, especially dyspnea, or functional status limitation despite optimal medical therapy. All of these patients may seek therapy because of distressing symptoms such as dyspnea, fatigue, or difficulty performing activities.
Like a bird on a tree, I'm just sitting here.
What are the problems in patients with COPD? First, we know that breathlessness is the most debilitating symptoms in these patients because their tachypnea, they don't want to move. They limit their physical activities, leading to deconditioning, and this deconditioning will lead to poor quality of life in these patients. That's why patients get trapped in the vicious cycle of inactivity and breathlessness.
I'm Meg. I'm respiratory therapist here in Pulmo Rehab. Initially, patients are deconditioned and they need to stop when walking or climbing the stairs just to catch their breath. So we do teach them the proper breathing technique, how to relax, and learn the upper body and lower body exercises to make them stronger, and do their daily activities with proper pacing to lessen the shortness of breath. One of the great aspects of being involved in pulmonary rehab patients is we get to witness their testimonials and enjoy watching them progress or improve with their exercises and live with more comfortable life.
Pulmonary rehabilitation was established in order to address the issues that are not addressed by pharmacotherapy. Patients are taught how to breathe properly, how to exercise, how to move about, how to improve their quality of life. Exercises will improve their function and hopefully will be able to allow them to engage in the activities that they would want to do despite the limitations of the obstructive lung disease. The benefits are not limited for chronic obstructive lung disease. They can be applied to other patients with other lung ailments that can cause impairment in their quality of life.
So what are the benefits of pulmonary rehab? First, it reduces the symptoms of dyspnea and also improves leg discomfort. They also improves the muscle strength and endurance in these patients. They also reduces the hospitalization and exacerbations of COPD patients. And not only that, they also improve the emotional function of these patients. And lastly, they also enhance self-efficacy and knowledge. They will be able to manage their disease, how to cope up with their disease, with the things that we teach in pulmonary rehabilitation.
I enrolled because I had difficulty breathing, and also seems like I developed some kind of allergies. I went to my cardiologist, do all the tests, we found out I have wheezing, I have the PFT and all the X-ray, and then they found out that I have mild COPD. Then my cardiologist decided that I be enrolled. And so I went to Philippine Heart Center because my cardiologist said this is the best place where I can get my rehab. And what pulmonary rehab is doing is to strengthen my muscles so I can monitor my breathing, so it will be easier for me to breathe. Yeah, highly recommended. In fact, there was one patient I saw and I said, I would love to talk to the wife because I would like to explain to her the importance of the rehab because it happened to me, it will happen to them. Wow! Yung mga ganyan.